Hi, welcome to HLS Partner Plays. I am your host, Michael Giannotti, and for Veterans Day, I'm wearing an old uniform, so please don't laugh. I can no longer button this, but I'm pretty excited because unlike this, we have some great stuff for today for our presentation. So we're going to be talking about price transparency and touchless intake, empowering patients and delivering opportunities to providers. We have some great content, and we're going to be talking to Natalie Lawrence in just a bit about that. I'm going to introduce her. But before we do so, I do have a couple of slides that I want to walk through as far as housekeeping. So number one, as with all events, this event is brought to you by Microsoft's Healthcare and Life Sciences Group. You can always visit our site at aka.ms/HLS-blog. That's aka.ms/HLS-blog. And you can find myself, all my colleagues there. We are happy to take questions, requests for content, and that's where you can also see upcoming events that are coming down the pike. Moving on, before we start, like I said, a couple of housekeeping items. So first of all, look, we encourage attendees to ask questions, so feel free to ask. In addition, all the questions posted are moderated. When you post something, it won't be seen by everybody. So if you have something you're not quite sure of, feel free. We don't just post those out and approve them. They come into us, we'll field them, tee them up for folks, or we can actually have a dialogue directly behind the scenes. In addition to that, we also love to know, where you are, where you're watching from. So feel free to give us a shout out. And then finally, at the conclusion of this webcast, it'll probably be tomorrow morning, we will take the recording from today's presentation as well as links to resources related to today's presentation, and we're going to make those live out at the same blog I mentioned earlier, aka.ms/HLS-blog. Again, aka.ms/HLS-blog. You'll be able to watch the recording, share it with your colleagues, as well as grab all resources cited. Last thing now, how to engage with Q&A panel. So first of all, if you are not seeing a Q&A panel on your right-hand side, you'll notice a little dialog box in your upper right. It has a question mark in it. If you click that, it will open it up. Also, if you click it, it will close the dialog box, so you can toggle back and forth. Once you open it up, this is the view that you'll see. You'll notice we have all questions. We have my questions, so as you post stuff, and if we are dialoguing directly with you, that's where all that'll show up under that tab. All questions are those that we publish and make available to the broader audience. And with that, we are going to turn this over. And before I do, I just want to quick introduce. We're going to be having Natalie Lawrence. She is a Director of Business Development, Connected Consumer Health, Change Healthcare. And Natalie directs business development for Change Healthcare's Connected Consumer Health Suite. It's a groundbreaking new consumer and financial engagement platform for healthcare providers. Prior to her current role, Natalie, at Change Healthcare, Natalie has worked at a variety of roles in the healthcare and information technology industry, including Fortune 10 companies and innovative startups. She received her BA in speech communications from the University of Georgia, which is right next door to me here in North Carolina. So with that, I want to go ahead and welcome Natalie. And Natalie, welcome to today's show.
All right. Well, thank you so much. And thank you for your service. Happy Veterans Day. Go Dogs. So, hey, everyone. I'm Natalie Lawrence. I'm the Director of Business Development for Change Healthcare's Connected Consumer Health Suite of products. And I am excited to spend the day talking about digital technology in the healthcare space. So to just sort of take a quick minute to give you some background on Change Healthcare, our organization is the largest healthcare IT organization in the nation. And so what that provides us is we actually sit in a very unique position. We sit between payers, providers, and consumers. And what this enables us to do is obtain access to information that allows us to develop technology to not only arm all of these three different constituents, but also to solve for some major healthcare issues that all three, payers, providers, and consumers, experience typically as siloed organizations. And we are very focused on breaking down the barriers and being able to transmit information across those three different organization types. As you'll see at the bottom, we have a very broad depth and breadth of touch, which allows us not only to touch nearly 900,000 physicians, we power $1 trillion worth of healthcare claims, and we are also powering 14 billion healthcare transactions. So again, lots of information across the industry that enables us to bring not only software solutions, but also services to foster innovation throughout the healthcare industry. And so today I'm going to really focus on how we are working with organizations to enhance patient experiences. And I wanted to start with just sort of looking at a broad understanding of consumerism. And so today I'm going to spend some time focused on one brand in particular. You'll see it's a hotel brand. But really what I want us to do is for everybody that's attending today's session, whether you're a healthcare executive, whether you're a Microsoft employee, whoever you are, sort of take your employee hat off and put on your consumerism hat for the next couple of minutes. Because everything that I'm going to talk to you about today not only is going to benefit the healthcare industry, but it's also going to apply to each and every one of us as we are consumers of care as well. So I'm going to start by focusing on a brand experience that Microsoft has created. It's a digital experience that enables their customers to shop for hotels. You can do that across all of the Marriott brands, and you can prioritize that based on location, brand, amenities, as well as price. In addition to that, you can book a hotel reservation directly through this experience, and you can also pay for this hotel stay as well, leveraging various payment options, whether it's credit, debit card, or also loyalty points as well. In addition to that, they also are promoting the ability to offload the stress for that individual who is currently traveling to that location, whether it's for business or for vacation. They enable notifications to help prepare that individual through reminders of the booking, as well as amenity notifications and directions to their property. As we just saw in this advertisement, they also provide the ability to check in remotely, as well as provide digital room keys. And so what this means for their travelers is that now you can actually not only book your reservation, but you can go through the entire arrival process without engaging a single Marriott employee. And finally, they also offer access to information. And so in this commercial, you'll see that really all they're going to promote is the ability to communicate directly with Marriott through a digital fashion. And so what they're doing is they're providing their customers the ability to access information at the time when the consumer needs to engage with Marriott. And so what this does is it actually builds trust. It builds trust that even though you're in a digital world, you have access to resources as you need them, and ultimately that drives loyalty. And so why do businesses invest in digital experiences? And so why would Marriott not only invest in an application, but also invest in an entire advertising campaign that really only promotes a free application? It's really to help differentiate. And so as we look at the various verticals that have made this enormous shift from brick and mortar experiences and manual experiences to this full digital experience, whether that's the hotel industry, the travel industry, or the banking industry, there are aggregators that have come to market that enable multiple hotel brands to be able to promote their availability on a website like booking.com. Or for the airline industry, they can all promote their flights through Expedia, and through Mint, an individual can manage all of their financial obligations. The problem with leveraging these aggregated services is that it prevents leakage. When I, as a consumer, go to booking.com, I have the ability to go to a different hotel brand than Marriott. And so that's why you see these individual brands heavily investing in what we call a digital storefront. I can go to Marriott's website. I can also go to their application, and I'm going to be able to get all of the information I need in order to engage with that brand. It allows organizations like Marriott to capture consumers, to improve experiences, and ultimately to drive loyalty. And it's become an extremely important core function of the growth strategies of many brands. But unfortunately, in healthcare, we're extremely far behind. And so as many patients are keenly aware, as well as healthcare executives, we've historically operated in a very siloed world. Systems don't talk to each other. Patients still pick up the phone to book their appointments. Patients are unsure of how to pay bills. We've seen an enormous spike in technology adoption as well as innovation, especially over the year of 2020. We've seen an increase in the adoption of telehealth, a strategy that's been in place for 10 to 15 years, but it took a pandemic in order to really bring that to the forefront, not only for the provider organizations, but also for consumers, as that is what we want and how we want to engage with our healthcare providers. There are also aggregated appointment booking solutions in the market today, but again, what that provides is the ability for that patient to go elsewhere. And 23% of healthcare organizations are not actually aware of how much revenue their organizations are losing because of patient leakage. And that loss is very costly. So for example, if we have 5 weekly patients lost to operational leakage, that equals $3,000 in revenue per patient, which is $15,000 per employed physician, and ultimately hits the bottom line of $780,000. And so we at Change Healthcare believe that organizations in the healthcare space must adopt a digital storefront. And we are ready to meet the industry demand with our solution that we call Shop, Book, and Pay. And so I'm going to get deeper into that solution in just a few minutes, but I want to spend a little bit more time exploring how healthcare will actually make this shift. And so today, healthcare is making this shift, and it's not happening in the core areas in which we are used to receiving healthcare. We see tons of innovation in those surround areas as Walmart Health enters into the healthcare space. Amazon, Walgreens, CVS, even Best Buy has moved into healthcare, and they're all going after the consumer. In these experiences, they are going against the traditional engagement that organizations have with patients as they engage with their healthcare providers. From the minute that you engage in a Walmart experience, even Walgreens or CVS, a patient can easily understand what services these organizations offer, as well as what that price is going to be. And in many instances, they're able to actually go ahead and pay for that in advance of that service. As we look at the consumer, there's a huge shift taking place in the consumer space as well. Patients are actually carrying much more of a financial burden than they ever have before. So I'd like to take a minute to define a couple of key terms for patients who are really affected the most by this shift in patient responsibility. The first is a patient that's enrolled in a high deductible health plan, and the way that the IRS defines that is an insurance plan that has a deductible of at least $1,400 for an individual or $2,800 for a family. So what this means is that a patient must pay either $1,400 or $2,800 out of pocket before they ever receive a true benefit of being enrolled in that insurance. So every procedure or every episode of care that that patient engages in leading up to that $400, they are responsible for. A second area that we're seeing an enormous growth is in the self-pay patient population. And as that is defined, it's a person who pays out of pocket for a health-related service in the absence of insurance. We're seeing not only a growth in this in the current economic environment as individuals are losing and changing jobs, but also as we keep an eye on the Affordable Care Act and the future of that. If that gets overturned, that is going to result in a drastic increase of self-pay patients as employers no longer would be required to provide that insurance to their employees. But the government is also on board with this. And so there's a regulation that goes into effect January 1st of 2021. And anyone that's spent any time in healthcare knows that unfortunately, there's a ton of innovation, but when you get a regulation, that's going to drive adoption. And so what that means is that on January 1st, providers are now going to have to promote pricing for 300 shoppable services. And in order to do so, they need a digital storefront. But we at Change Healthcare also like to focus on what do the patients want? And as these trends continue to surround the healthcare industry, putting more and more pressure on us to really start to think and adopt new digital technologies and experiences, we like to get a pulse directly from our end users, who are those patients. And so getting that direct from consumer information to bring back directly to our products and services so that we have a great understanding of the expectations that patients have of their healthcare providers, so that when we deliver our tools through healthcare organizations, they're going to meet those patient expectations. And so most recently, we engaged in a Harris Poll study where we did a study across the nation of nearly 2,000 individuals. And some of the key findings that we found in that study were that 67% of patients feel that finding a great doctor or medical practice is like finding a needle in a haystack. I'm willing to bet that a Marriott loyal customer is not complaining about being able to get access to information. It's extremely hard as a patient, especially when you think about shopping for a procedure. When you think about you've just moved to a new town and you need to find a new doctor, where do you even start? 59% of patients have said that they've actually gone into an appointment before without being sure if they can afford it. So when we look at this impending transparency regulation that's coming down the pipe January 1st, and we align that with the costly efforts that organizations have in trying to collect from patients after their episode of care, we are very interested in how do you bring more information to the patient prior to that service, not only providing them with that transparency, but also providing them with more options and how they can afford that care. And 53% of consumers actually said that they've avoided seeking care because they weren't sure of what the cost would be. And so again, it's providing that individual with access to information, reducing the fear factor that just a price might have on keeping patients outside of the doors of an organization. That not only affects volumes and revenue, but it ultimately affects quality as well. And in addition to that, 52% of patients say that they're willing to pay in advance if they just knew what that cost would be. And so for healthcare organizations, as we really look at all of these market drivers, as well as this push for digital transformation, not only are we going to be able to meet the consumers where they want to be met, we can also transform the way that we produce as a revenue cycle function as well. Now, there's a lot of jobs to be done, and so I'm going to spend a couple of moments on just sort of our approach at Change Healthcare of how organizations should really be looking at how to move through this digital transformation as a strategy. So we recommend a digital-first approach with a key focus on attracting and retaining patients. And so when I say the word attract, that's not only attracting net new patients, and so those patients that might find you by going to Google and coming to your home page, you also need to attract those patients that maybe aren't that loyal yet. And we're finding that patients in today's society are not loyal to their community provider. And so you're constantly having to attract even those known patients. And if you do that correctly, you're ultimately going to be able to retain them as well. And so not only getting that patient aware of the services that you provide and choosing your organization, but the nurturing that it takes from the time that that patient chooses your organization for their care to actually getting them through the doors of your facility to receive that episode of care. And so this is a part of our Connected Consumer Health suite of products. You'll see here we have 6 different modules in a very methodical way of rolling these out to organizations, again, with those key focuses on attracting patients and then retaining those patients as well. And we're really focused on improving the business of healthcare through digital enhancements. And so the way that we break down the patient journey in healthcare is really looking at what are all of those touch points that we should have with a patient from a pre-visit perspective, at the time of visit, and post-visit. Just like Marriott offers the opportunity before you book to get access to information, they start to push information to that traveler to prepare them for their visit. And then after that visit, being able to drive those loyalty points and reminders of promotions. We're taking those same best-in-class touch points and we're bringing that to healthcare. And really our key focus is going to be on driving patient acquisition, improving operational efficiencies through digital touch points, offloading a lot of those manual burdens that staff have in making sure that patient actually arrives for the care that they need, and really with that key focus of driving loyalty. And if we do our jobs correctly, we can increase volumes and revenue, we can reduce operational burdens, and we can ultimately improve the quality that our patients receive from our organizations. All right, so let's take a look. I'm going to take you through an entire digital patient journey, leveraging our entire Connected Consumer Health suite of modules. And so we'll go ahead and jump in. So again,
Natalie?
Yes.
I didn't know if you wanted to take any questions at this time or if you wanted to still wait.
No, I'm ready.
Okay. So we have a couple of them. The first is, what is the effort needed to implement your solution? Do we install something, or is it a cloud service we license then use?
Absolutely. So for our Connected Consumer Health suite of solutions, it's fully cloud-based. Everything is also web-based, and so no hardware requirements, no on-prem, no investments required. We do take a very agile approach to deploying software. And so 30, 60, 90 days are our key targets for implementation. It really ranges based on module as well as scope or sort of the breadth of an organization and how those timelines might expand a bit.
Great. I think that answered that. Next, it says you showed phone screens earlier. So do you provide the transparency you highlighted on the slide. On the slide, it's not just regulation through the mobile phone applications. So I'm trying to, I guess there was a slide you had.
Oh, probably through this.
It said the slide was, it's not just regulation.
Yes. Yes, this.
Yeah, I think that's what they're referring, because that's when it came up, I saw. And they're asking if you provide some of the views or transparency around this through the mobile phone applications.
So I'll answer that in a couple different ways.
Okay.
So our Harris Poll study is public. And so if it's the data behind the study that someone's interested in, we can add that too as a link after this presentation. From the way that we deploy our solutions, they are web dynamic. And so whether it's projected on a cell phone, whether it's projected on a computer, it automatically adjusts to that size. So from a Change Healthcare perspective, we are not really focused on heavy applications. I know I promoted that through that Microsoft experience. It's really about digital engagements, regardless of whether that patient comes to your organization through your website or through a mobile site, or if there's a way that we can proactively engage that patient to bring them through your experiences as well. So I'm hopeful that through the demo, we'll be able to sort of show you how those proactive touch points, whether it's through text or it's driving a behavior to help prepare that patient for their appointment. Those are all ways that we can help make sure that patient is aware of not only the services that your organization offers, the transparency related to cost, the availability you have as an organization to get that patient in, but also a lot of the operational tasks that need to take place as well, and offloading that from the patient having to wait in your waiting room. So hopefully I answered that. If I did not, I am happy to clarify further.
All right. Well, we'll see if they pop something back. Then the last one, it says you mentioned the patient. I think you already answered this one. You mentioned the patients are not loyal to community providers. Does your solution also help build loyalty, and how?
Yes, absolutely. So we are very focused on helping providers drive loyalty. And so it's really about, I actually met with a CFO a couple days ago, and we were walking through our solution and how, engaging with the patient at a timely manner is extremely important in deploying a digital transformation strategy. And as I was walking through the various times in which we would want to trigger out a text message to a patient to drive that behavior, he said, Natalie, you sort of sound like the helicopter parent of healthcare. And I sort of giggled and sat there for a minute, but that's absolutely what patients need. And I think patients want that. We have data where 2/3 of patients are saying, I'm not hearing from my healthcare provider too much. And so there's a lot of opportunity and appetite for patients to hear more from their patients. And so the easier that you can make the management of one's healthcare, the more likely it is that they're going to choose your organization. And so we recommend that it's not only looking at hitting that price transparency requirement that you have to hit on January 1st, it's how do you add more features to keep that individual engaged on your website longer than they would and prevent them from going somewhere else. And so when you see these additional features that we offer, it's really about capturing that individual, engaging them, converting them to be a consumer of care at your organization. But again, making that so streamlined through reminders, the ability to rebook, the ability to do online forms, the ability to wait in their car upon arrival. And those are all things I'll go through in this demo. But once you have that experience for the first time probably ever in healthcare, where you say, wow, that was extremely easy, and you walk out and you get a reminder of, don't forget, you need to book that appointment as a follow-up and click here to do so, that's where you start to just really capitalize on the loyalty of a patient by just meeting them in their busy lives and making it extremely easy to choose your organization for that care.
Excellent. We had one more that came in, but I'll save that for a little bit later and let you continue on.
All right. So I'm going to go ahead and jump into a demo. Again, if you want to stop, ask any kind of questions, that's fine as well. And so keeping on that idea of that digital first approach to attract new and retain known patients, it's really about what's your entry point. And so the first entry point is going to be your website. You want to monetize your website by, if a patient goes to Google, they are truly shopping for a provider. And when they come to your website, they should have all of that information that they need in order to choose your organization. In addition to that, we are very focused on missed care events. And so what I mean by a missed care event is an opportunity where there was a known patient, but the revenue and volumes were not captured because the patient never actually came in for that care. And so when we look at this as opportunities to engage that known patient, it's at the time of a referral order. It's at the time that the patient books an appointment. It's at the time that they need preventative care. And so an example is, it's the month of November. This is Prostate Awareness Month. Being able to engage proactively all of those patients that should be coming in for their November procedures. It's also looking at those follow-up requests. Once you have that patient that's just walked outside of your door, how do you ensure that they come back in to get the care that you discussed with them? And ultimately, if you're doing that correctly, you're going to reduce the long-term costs associated to care over time. And so today, our patient is going to be Sue. The demo, or our touch point, starting point, is going to be that follow-up request. So she's a known patient. We are reminding her that there was a recommended follow-up for her to go ahead and come back to our organization. And so being able to text Sue with the ability, or with the reminder that she needs to book that appointment. And so that link then brings Sue to your website. Again, this is going to expand to fit the screen and device in which Sue is on. So whether that's a cell phone experience, should be exactly like that website experience. And so Sue now has the ability to search for the procedure in which she needed. This is what we call shop, book, and pay. You'll see here she's searching for an MRI with contrast. She can see all of the various locations in which she can get that care. One thing I'm going to note is, going back to that example of other industries and those aggregator type of websites versus creating that true brand presence. We at Change Healthcare are really focused, and we feel like each health system needs to really develop their own brand. And so think of this as a walled garden. This would be your health system's website and logo, with the ability to show all of the various locations within your health system in which that patient can receive their care. So we're really focused on preventing leakage through your organization. So in this example, Sue's going to go ahead and schedule her appointment at Parkside Imaging Center. She sees that the cost is $490. So she's going to go ahead and book that appointment. At this point in time, Sue's not going to pay for this, but you will see she does have the opportunity to go ahead and check out for this service as well. So just like any other type of e-commerce experience, she does have the ability to go ahead and check out. But today, Sue is not going to go ahead and check out. And so she's just booked her appointment. So we would receive notification of that. We're going to go ahead and confirm that appointment with Sue. This is sort of that first operational offload that we're able to provide health systems. We're actually communicating that appointment confirmation versus someone having to pick up the call or pick up the phone and remind the patient or remind that patient of that appointment. From there, we're going to re-engage Sue prior to that appointment to go ahead and see if she does want to go ahead and shop or go ahead and pay for this appointment. We never want to prevent a patient from coming in and receiving the care that they need, but we do want to offer them opportunities to be able to understand costs and go ahead and prepare for those costs. So you'll see here, we're providing her again with that total out-of-pocket fee, as well as with options for how she can go ahead and start to pay for that. She can pay by card, she can pay by Care Credit, by PayPal. And what this does for Sue is it provides her with options that can be long-term payment methodologies, not requiring that she pay 100% at that point in time. But for our health system organizations, this moves your revenue cycle to the front of that experience. So before Sue's ever even come in for that appointment, you're already receiving that entire patient responsibility. And so going back to our engagement with Sue, she has now shopped. She has booked that appointment. She may or may not have paid for that appointment. If she doesn't pay, she can always go through traditional revenue cycle workflows where we bill her on the back end of that appointment as well. But now we're going to start to engage her to prepare her for that appointment. And so we have the ability to go ahead and send her forms. In a COVID world, this reduces the touch points and the opportunity of spreading the virus through those various touch points within an organization. Another thing with going ahead and providing Sue with the ability to complete forms ahead of arrival, we find that the quality of data improves as Sue has access to information at home that she might not know off the top of her head while sitting in a waiting room. Other efficiencies we find are reduction in wait times. A lot of times we have patients that are completing their forms as they wait in our waiting rooms, but we actually have the ability to bring them back much sooner than that. So by providing forms to patients to complete ahead of schedule, we can also reduce those wait times not only for the patient, but also for staff members as well. And so as Sue engages in this digital experience, she does a few identifying measures. So we make sure that we give her her specific forms, and then we provide her with the ability to go through those forms. A couple of key things that I love about our platform is that we're creating a master database for Sue. And so one of the major complaints of patients, and even one of mine personally, is that you fill out information for a provider and you come back, even if it's a week later, and you're asked to fill that information out again. Or you are loyal to a health system and you go from provider to provider, but you're still required to continue to fill out those same forms, regardless of how many times you go to that health system. We're creating a master file for Sue. And so the first time that she comes through this digital experience, she is going to be asked to complete as many forms as are needed. We have the ability to put expiration dates on forms. And so if it's a HIPAA form, we can only let Sue see that once every 365 days. In addition to that, now Sue is going to be validating information that she has already filled out before, rather than having to input that every single time. So when you think about medical history, information that typically doesn't change on a regular basis, address, birthday, information like that. And we can take in those forms in many different fashions. So we can support discrete data inputs, we can support checkboxes, e-signatures, and then also helping you capture those artifacts as well. So when you think about your driver's license, your insurance cards, it's being able to allow Sue to either upload those from her computer if she's at her home, just like she would upload a document to any other type of application, or leveraging the value of a smartphone in being able to take a photo or pull those images from her photo library. So once she's completed her forms, we can then start to prepare her for the appointment. And so when you think about staff members typically having to call patients, having phone tag, leaving voicemails that are never returned, to ensure that that patient is confirmed for that appointment and prepare them for their arrival as well, we have a huge impact on that from an operational perspective through a digital methodology of being able to help prepare that patient. And we can do that at the appointment type. So if it's a surgery and the patient needs to fast, if it's a physical therapy appointment, you want to remind them to wear comfortable clothes, whatever it is that needs to be communicated to that patient, we have the ability to do so directly. Also, always reminding that patient of where that appointment is with the ability to map to that location as well. And ultimately, on the day of arrival, being able to go ahead and start our engagement with Sue, reminding her of that appointment. We see that when we do same-day reminders that we reduce patients' no-show rates. So we typically, send that out 2 hours prior to their appointment. Also, always providing them with access to the organization, not just through a digital fashion. Sometimes when you're booking an appointment and you've forgotten about an appointment, it's easier just to pick up the phone and call someone. And so you'll see throughout this, we offer the ability to always call back into that organization. But from there, it's really being able to now check in that patient. And so providing the ability for the patient to click a link upon arrival. In COVID times, we've seen a huge uptick in patients who are a little hesitant in going back to their healthcare providers, those that are maybe higher risk or just want to continue to social distance. And so this is a great opportunity for organizations to be able to reduce some of that fear factor and also protect their patient population, allowing that patient to wait wherever it is that they are more comfortable, whether it's their car, a main lobby, or in that waiting room as well. But we would provide Sue with a link to where she can now check in for that appointment. And so through every aspect of this digital transformation, it's really important to look at what are all of the physical touch points, verbally and non-verbally, that a patient typically engages in when they engage with a healthcare provider. And I think when we really look at this check-in experience, that's where we get to that non-verbal information that a patient typically receives that is very at high risk of being lost in a remote check-in experience. And so you'll see here we're providing Sue with an understanding of what her wait time might be. We're also going to provide her, just like she would when she comes in and fills out that clipboard with that check-in list, getting her name, her last name, and her phone number, but also being able to supplement that with what she would visually be able to capture by being in a waiting room with other patients. How many patients are ahead of me? How many patients are waiting in line? What's the physical appearance of these patients? Are they bored? Are they aggravated? Does it look like they've been here for a long time? And so trying to provide that information to a patient to better set that expectation as well. And so not only providing that wait time recommendation, but also letting Sue know that she's 7 in 7, or 7 in line out of 7 patients. We also are going to communicate with her, letting her know that we are aware that she's there. So confirming that there is someone on the other side of this experience that is expecting to help bring her from the car where she's waiting through to the facility. And so as that patient, Sue, is now sitting in their car or in that waiting room, it's also being able to start communication with them. If there were any registration needs in the COVID world, being able to help prepare them for what they are going to need to do as they enter into that facility. Be prepared to wear your mask. Be prepared to get your temperature taken. Go to registration before you're, escorted up to the department. Over communicating to patients who are not necessarily right in front of you. It's also confirming that you are aware that Sue has arrived, being able to start two-way dialogue between the patient and the provider organization. If forms were not completed, being able to push those back out to Sue. If there's information that you need, being able to connect with Sue via phone as well. And so you'll see everything that I've done up until this point of the experience has not required a single person from the facility to engage. These are all self-service, digital, automated engagements that we are able to do on behalf of the organization. It's once that patient arrives that they notify a staff member, and at that point in time, the staff is now engaging. So think about all of the operational burden that we're able to offload in this traditional setting. And so once we're ready for Sue to go ahead and enter into the facility, we can start to communicate to that to her, exactly where to go, if she's going to be escorted to a certain department. And then we also have the ability to communicate amongst departments. So a lot of organizations are bringing a patient into their main lobby, they're registering them. At that point in time, that registration staff member can now communicate to the department that that patient is ready. And that department can then communicate directly to the patient that they're ready for them to come upstairs or wherever it is that that patient needs to go. And just like when we are preparing that patient for arrival, we want to provide that same level of service, both digitally and in person. So just as you do when that patient walks out the doors of your facility, thanking them for choosing your organization, providing them with information should there be any kind of need for them to contact you again, as well as this is where we really start to drive that loyalty opportunity, providing them with those reminders, that helicopter parenting type of experience to make sure that it's easy as possible for them to shop, book, and pay for that next procedure that was recommended. So I'm going to pause there and see if there are any questions.
Yeah, we actually have a couple. So the first says, so since you use a web-based experience, then it's available on any device with a web browser, and I'm assuming that the answer is yes for that.
It is, correct.
Yep. Is there, do you know if there's a browser, like a cutoff, or is it just any HTML5?
Oh, the actual specs of the browser?
Yeah, if there's like a baseline or, you know, minimum standard on that.
I do not know that off the top of my head. The design is responsive, but as far as, you know, I don't think there's any dependencies on a actual browser requirement.
Gotcha. Next is, I like the idea of monetizing our website. Can we then, at conclusion of using your service, and they said forms and check, forms and check in, then push them back to our website? Oh, okay. I'm going to say this is a yes, because you do have links to, you're showing links in that last slide. You just had links to surveys. So you could, in essence, then push them to anything web-based, correct?
Absolutely. Yep. And so that's where we really see that digital storefront. And so that shop, book, and pay solution is your storefront for your website. And so that's where, whether I'm Google searching for a provider and I come through your organization that way, or you're reminding me here that I need to go back through that experience, it's going to be seamless no matter which way I engage, whether I'm proactively engaging with the organization or whether you're proactively engaging with me to get me back in. And the more that that patient goes through that shop, book, and pay experience, the more value they're going to see in that. And so again, we break this up from a modular type of perspective to be able to support that shopper in converting them to a consumer. And that conversion can either take place from the booking, the paying, or that combined effort of being able to create that entire experience for the patient.
All right, so I had two others. One, if I'm not the low-cost provider in my market, how will price transparency help me?
Yes, so we get that question from a lot of organizations. And so really, On January 1st, the regulation requires that all hospitals across the industry compete on a minimum of 70 services. So I know when I went over the regulation, I stated that it's 300 shoppable services. CMS is requiring that 70 of those be standard throughout the industry. So every hospital is going to have the same 70 shoppable procedures. Whether you're the low-cost provider or whether you're the high-cost provider, and I actually even say even more so if you are the high-cost provider, it's really important to create a better experience for your patients. And so even if you are higher cost, being able to keep that patient on your website, being able to drive your brand loyalty, being able to provide that patient with seamless access to information, to being able to book, to being able to pay, that's how you're really going to differentiate even if you're the higher cost leader, you're providing more value to your patient. Than just a low-cost leader that may just be providing that price and not providing an experience.
Awesome. And then I have one additional to toss your way. If let's say they've already purchased a price transparency solution, but it just does something like estimates, is there a way to complement their estimation tool with your services?
Yes, absolutely. And I think that is, I think that's going to be the true power of transparency. And so we do have a lot of organizations that are looking at, what is the difference between an estimator and a digital storefront? An estimate is an estimate. It's hard to collect off of. It can change. And there are services that patients are looking for just an understanding of how much is this going to cost me. That's where that estimator tool is extremely valuable. But when you really think about the shift to consumerization, and CMS defines a shoppable service as a procedure that can be scheduled in advance. That's where we really feel organizations should be focusing their attention on a storefront strategy. Really focusing in on those 70 shoppable procedures, shoppable meaning being able to book them in advance, as well as shoppable, competitive based on price. Focusing on those 70 at a minimum, growing that to be your entire 300 or even more shoppable services. To be able to really capture that patient as they're on your website. And so I truly believe that a digital storefront is your ability to convert very quickly that shopper to be a consumer, where the estimate is a great value for those patients who are looking at maybe those larger procedures that aren't deemed shoppable. It's more informational. They're going to need more guidance from your organization, more financial counseling options, and that's where those estimate tools really become extremely valuable to organizations as well.
Excellent. And that's all we had on the question front.
All right. Well, just to summarize, from a Change Healthcare perspective, we are, highly expecting e-commerce to reshape the healthcare shift to digital. It's been a long time coming, and we feel like with the partnerships in which we have in place between not only Microsoft but also Adobe, that we are well positioned to help organizations take a very methodical approach to digital transformation while also preparing for this strong shift of consumerization that we feel we're going to see in the market come January 1st.
All right. So is that all you had for us today?
That is all I have.
Well, so just to let our users know, at the conclusion, I don't know if we're going to have these slides, or I do know there are some links coming our way from your folks. So we'll be posting, obviously the recording, And just to reiterate, I'm going to quickly share out, whoops. I'm going to share my screen, which is screen 2, and that should pop into place. So if you come to, again, aka.ms/HLS blog, that will bring you here to the Healthcare and Life Sciences blog. So tomorrow we'll be posting a recording of today's session. In addition, any links and resources they provided, we'll put those up as well. And you can also come here, and we do have some upcoming events. There's another one that's going to be hosted by our Samantha Brown and one of my friends as well. So, feel free to check those out. But I want to thank you, Natalie, for joining us here today. And any final words that you'd like to say before we conclude?
Sorry, I was stuck on mute.
No,
Mike, I just can't thank you and Microsoft enough for inviting us today. We really appreciate the opportunity and look forward to continuing our strong partnership.
Thank you very much. So to everybody else, have a great Veterans Day and take care, and we'll see you next time here on HLS Partner Plays.